Gonorrhea is a common sexually transmitted infection, or STI. It affects millions of people worldwide each year. Because it can be asymptomatic, meaning, well, some people don't have any signs of infection, it's important to understand how it spreads and how to protect yourself. Knowing the facts about gonorrhea is essential for everyone, regardless of relationship status or sexual history. The more we understand about STIs, the better equipped we are to make informed decisions about our sexual health. Gonorrhea doesn't discriminate. It affects people of all backgrounds, ages, and sexual orientations. This essay will provide you with the knowledge you need to stay safe and protect yourself from this common infection. Remember, knowledge is power when it comes to our health. Gonorrhea is caused by a bacterium called Neisseria gonorrhoeae. This bacterium thrives in warm, moist areas of the body, including the urethra, which is the tube that carries urine out of the body, the cervix, which is the lower part of the uterus, the rectum, throat, and even the eyes. Gonorrhea is spread through sexual contact. This includes vaginal, anal, and oral sex. It can also be passed from a pregnant woman to a baby during childbirth. It's important to note that you cannot get gonorrhea from casual contact. That means you can't get it from hugging, kissing, sharing utensils, or using the same toilet seat as someone who has the infection. Many people with gonorrhea don't experience any symptoms. This is why it's often called a silent infection. However, when symptoms do occur, they can vary between men and women. Men may experience a burning sensation when urinating, white, yellow, or green discharge from the penis, and pain or swelling in the testicles. Women may experience a painful or burning sensation when urinating, increased vaginal discharge, and bleeding between periods. It's crucial to remember that these symptoms can also be caused by other conditions. So if you experience any of them, it's essential to see a doctor to get tested and receive the appropriate treatment. Let's meet Sarah, a 22-year-old university student. A few weeks ago, Sarah started experiencing painful urination and noticed an unusual discharge. At first, she dismissed it as a minor infection, but when the pain worsened and she started bleeding between periods, she knew something was wrong. A visit to her doctor revealed that Sarah had gonorrhea. She was shocked and scared. She hadn't considered the possibility of an STI, believing she was in a monogamous relationship. This diagnosis was a wake-up call, highlighting the importance of open communication about sexual health with her partner. Now, let's meet David, a 30-year-old accountant. David had been experiencing pain in his testicles and noticed a thick yellow discharge from his penis. Embarrassed and unsure of what to do, he ignored the symptoms, hoping they would go away on their own. Unfortunately, David's silence had consequences. The untreated gonorrhea led to a serious infection in his epididymis, the tube that carries sperm from the testicles. This could have long-term implications for his fertility if left untreated. Both Sarah and David's stories highlight the importance of seeking medical attention if you experience any unusual symptoms. Early diagnosis and treatment are crucial for preventing serious complications from gonorrhea. Diagnosing gonorrhea is relatively straightforward. Your doctor will ask about your symptoms and sexual history. They will then take a sample of urine or swab the affected area, cervix, urethra, rectum, or throat, to test for the presence of the bacteria. Once diagnosed, gonorrhea is easily treated with antibiotics. It's crucial to take the entire course of antibiotics as prescribed by your doctor, even if your symptoms disappear before you finish the medication. This helps to prevent the infection from returning and becoming resistant to antibiotics. It's important to note that if you're diagnosed with gonorrhea, your sexual partners will also need to be tested and treated, even if they don't have symptoms. This helps to prevent the spread of the infection. Prevention is always better than cure. The most effective way to prevent gonorrhea is to abstain from sexual contact or be in a long-term, mutually monogamous relationship with a partner who has been tested and does not have STIs. If you are sexually active, using condoms consistently and correctly every time you have sex is crucial. Condoms act as a barrier, preventing the exchange of bodily fluids that can transmit infections like gonorrhea. Remember, your sexual health is important. Don't be afraid to talk to your doctor about any concerns you may have or to get tested regularly for STIs. Early detection and treatment are key to staying healthy and preventing long-term complications.